Should you be cupping your arm after throwing? Let's talk about it in this video, as well as how you can do it if you're going to do it. Cupping is something that we get questions about virtually every single day. We get athletes texting us, emailing us, or going through our website, WIHTOUT.com, to ask us, should I be cupping my arm? Is cupping going to be beneficial? And when we have injured athletes, they always say, can you throw some cups on me? We have some videos on this in the past. We've chatted about it before, and we do think cupping is beneficial for a few things. It's not something that's just a complete fad that has no benefits, but the benefits are limited to a few different things, and these are the following. Number one, if you've got an adhered scar, a scar that's stuck down and it's tacked down and it's not moving, the cup is nice because the cup lifts the skin. So because the cup lifts the superficial layers from the deeper layers, it can kind of pull off a tacked down scar that's stuck down to some of the deeper fascial layers. So that would be my number one application for injured athletes with cupping. And then number two, it does help some tissue extensibility, especially for things that are closer to the surface, and maybe improve a little bit of blood supply to superficial tissues. It's not going to do a ton to help you recover, but if it feels good and it maybe helps you feel a little bit looser after, I'm all for it. I don't think there's any negative repercussions from doing cupping besides, having some hickey-like marks on your arm. So with that said, it's not something we use all the time. It's not something we advocate for, but if you're going to do it, it's something you can quickly do on yourself, and we'll show you what we're going to do here today. If you're looking for the most comprehensive resource on training and rehabilitation of the throwing athlete, check out my book, Arm Alloy. The link is in the description. Now, back to the video. So the very first thing we're going to do is we use a rock rub from Rock Tape. You can use any sort of lotion or salve on there, just something that kind of create a little bit of a suction effect when the cup is applied, but also something that moisturizes the skin a little bit, because when the skin is really dry and you stretch it, it's not going to feel real nice. Skin accounts for about 2% in normal tissue. Skin accounts for about 2% of restriction in angular, joint range of motion. So if you stretch your flexor tendon out, and you're actually stretching into extension, your skin and superficial tissue will account for only about 2% of that restriction in motion. However, when things aren't sliding properly, like we commonly see after surgical intervention and those sorts of things, it can account for a lot more after that scarring effect. We see that on the Achilles tendon, for example, all the time. So we actually lather it up just a little bit to create a suction effect, and then we can do two different types of cupping. Static cupping, where the cup just doesn't move and it stays there, or a dynamic cupping where you're moving it around. We also have the option of putting a cup on and then moving the tissues underneath. So he can keep the cup right there, but then move through keep that cup right there and then just move through grips. So he's moving some of the tendons underneath, and then he can move through a little bit of wrist motion either way. And we'll show the same thing at the elbow. A lot of times manual therapists might move that. It's not really worth our time to spend a lot of time doing this in therapy unless there's a scar adhesion. So moving this cup can get us into some areas that maybe are a little bit more tacked down, not moving so well. And if you find an area that feels more restricted, you could spend a little bit of time on that area specifically. Something easy to do on a bus ride home from a game, or something easy to do kind of in some off time, just as a little bit of active recovery. And you've seen cupping become more and more popular recently, and that's because people tend to feel good after. And if you tend to feel good after, we're all for it. Same thing with the tricep if you want to show with a little bit smaller cup. So you can get just a smaller cup and actually go into some more intricate, locations. We stay off of the ulnar nerve just here on the inside of the elbow, right across here, because just sometimes it does get a little bothered. So you go into a little bit of a smaller area here and use a smaller cup. You can glide it around, do some static cupping, maybe leave it on there for a few minutes. But that's really what cupping is designed to do is get the different layers of connective tissue sliding and gliding. And there has been some ultrasound research that shows that will increase blood flow to more superficial muscles if they're only a few millimeters below the surface, because there's a suction effect that goes down below the skin as well. So that's kind of our position on cupping. Something we will use here time to time. It's something you can definitely use in your own recovery, particularly if you have some tissues that just don't feel quite like they're sliding or gliding the way that they need to be doing. If you guys are interested in more of our content, make sure you subscribe to the video. Have any questions specifically for Don or myself, reach out to us, overheadathletics.com, and then just go through our contact us form. We'll see you guys in the next video.